Title of my talk is Global Epidemiology and Current Treatment of Kidney Cancer. My name is Ikenna Kingsley Uchendu. This is the outline of my talk. We would look at the background, look at the global epidemiology of kidney cancer in the worldwide. We would now look at the epidemiology of kidney cancer in selected Eastern and Central European countries. We would also talk about the current treatment and advancement made so far in combating the disease. Then we will look at the conclusion and the references. Background, first of all. Renal cell carcinoma, which is another name for kidney cancer, is a condition in which cancerous cells develop in kidney tubules. Now, there are three main histological subtypes of renal cell carcinoma, which are clear cell, which constitutes 75% of renal cell carcinoma, papillary, which constitutes 15 to 20% of renal cell carcinoma, and the chromophobe renal cell carcinoma, which constitutes 5%. Now, the remaining 15% of kidney tumors are nephroblastoma, which is another name for Wilms tumor, constituting 5 to 6%, transitional cell carcinoma, which is 8%, renal sarcomas 1%, and renal medullary carcinomas 1%. The global prevalence of renal cell carcinoma is increasing annually, and the causes are multifactorial. Earlier detection and more sophisticated therapies have decreased kidney cancer mortality. Vast geographical and regional differences in prevalence rate are the primary epidemiologic factors of kidney cancer, whose cause is largely unclear or unknown. Smoking, obesity, having a history of hypertension, and chronic renal disease are recognized risk factors for the disease. The 14th most prevalent cancer in the world is kidney cancer. It ranks as the 9th most prevalent cancer overall for men and the 14th most common for women. According to World Cancer Research Fund International, there were more than 430,000 new cases of kidney cancer in 2020. Providing periodical estimate of the global burden of cancer is one of the duties of the Cancer Surveillance Branch of the International Agency for Research on Cancer. The 2018 estimate of cancer incidence and deaths from GlobalCan 2020 are updated from previously published estimates. Now we're looking at the global epidemiology of kidney cancer. What you see is the estimated number of prevalent cases 1 year as a proportion in 2020 for kidney cancer, for both genders between the ages of 15 to 74. Now, from the map, you could see that the prevalent cases in proportion was highest in Eastern European countries and North America. And to be let's specifically mention the countries: Russia, Belarus, Ukraine, United States, Canada, Australia, and Argentina. They all have greater than 7.9 proportions per 100,000 population. Now, in the second place ranking in terms of prevalent cases is the proportion 3.4 to 7.9 per 100,000 population. And this occurred in countries like Kazakhstan, Mongolia, and Brazil. These prevalent cases are mostly found in Africa, where the proportion was less than 0.65. And the countries here, it occurred in the following countries: Congo, Uganda, Zambia, Madagascar, Mozambique, among others. And what you see here is the estimated age standardized mortality rate in the world in 2020 for kidney cancer for both genders between the ages 15 to 74. On a careful look, you would see it follows the same pattern. It follows the same pattern as the prevalent cases, where the countries mentioned to have the highest prevalent cases also have the highest mortality rate here. Countries like Russia, Ukraine, Belarus, United States, Canada, they are among the top ranked country in terms of estimated mortality rate. Now, the second place were still countries like Mongolia, Kazakhstan, and Brazil. The list are still countries in Africa. Africa ranked lower with less than 0.8 ASR per 100,000 population. Now, this is the epidemiology of kidney cancer in selected Eastern and Central European countries. And it shows the estimated number of prevalent cases in 1 year in 2020 for kidney cancer, both gender between the ages of 15 to 74 years old. Now, from the map, from the pie chart, you could see that the Russian Federation had the highest prevalent cases, followed by Germany, France, United Kingdom, Italy, Spain, Ukraine. Then every other European countries they considered them among others, and they were 29.6% altogether. So the Russian Federation had the highest. Now, the second pie chart shows the estimated number of deaths, mortality, in 2020 for kidney cancer for both gender between the ages of 15 to 74 in Eastern and Central European countries. On a careful look, we would see that it follows the same pattern as the prevalent cases. The Russian Federation had the highest, followed by Germany, France, United Kingdom, Ukraine, Poland, Italy, and every other European countries forming or constituting the others. The clinical approach to treating individuals with renal cell carcinoma is constantly changing due to new drugs and drug combinations. They highlight an overview of current standards of care for advanced renal cell carcinoma, as well as the most recent therapy advancement that are discussed first. First is the lenvatinib plus pembrolizumab combination. Now, this combination has always formed the first-line therapy for renal cell carcinoma, and it has been transformed by the use of checkpoint inhibitors and tyrosine kinase inhibitors. Now, in the most recent trial that was done together with pembrolizumab axitinib combination, avelumab axitinib combination, and nivolumab cabozantinib combination, was the pembrolizumab and lenvatinib combination. Another drug that's been used to treat renal cell carcinoma is the benzotifan. Benzotifan is an hypoxia-inducible factor 2 and 2-alpha inhibitor. This was the subject of two studies that were presented at the Genitourinary Symposium of the American Society of Clinical Oncology in 2021, ASCO 2021. And the principle of action of this drug, the pharmacodynamics of this drug is this. If cells are below hypoxic stress, hypoxia-inducible factor proteins become activated. They enhance neoangiogenesis, proliferation, and tumor growth by acting as transcription factor. Due to the widespread absence of a suppressor gene called von Hippel-Lindau tumor suppressor gene, HIF proteins build up in renal cell carcinoma, thus promoting the disease. Benzotifan prevents HIF2 and HIF1 from heterodimerizing, reducing the ability to cause cancer in a patient. Another drug is cabozantinib. This drug is specifically used to treat papillary renal cell carcinoma. A number of small trials were presented that examined cutting-edge therapies for non-clear cell renal carcinomas. The most prevalent non-cell clear red cell carcinoma is papillary carcinomas, for which sunitinib was formerly the standard therapy due to less conclusive data. Patients with non-clear cell histology were not included in studies examining the use of immune checkpoint inhibitors in conjunction with the tyrosine kinase inhibitors or double immune checkpoint inhibitor as a first-line treatment for advanced illness. The current standard of care for renal cell carcinoma. For fit patients with metastatic clear cell renal cell carcinoma, the first-line conventional treatment consists of either double checkpoint inhibition or a tyrosine kinase inhibition. Pembrolizumab axitinib combination, nivolumab cabozantinib combination, and pembrolizumab lenvatinib combination have all shown, compared to sunitinib, there is a survival advantage regardless of the PD-L1 status, programmed death ligand 1 status. Nivolumab plus ipilimumab combination has an overall survival advantage over sunitinib in poor risk disease illnesses. As a result, it's also a recommended therapy standard in this patient population. The prevalence and mortality of renal cell carcinoma vary widely around the world. A significant number of biomarkers for renal cell carcinoma have been studied and reported for diagnostic and prognostic purposes. However, none are yet accurate enough to be widely used in clinical practice. Additionally, earlier diagnosis and better prognosis may result from advancements made along the diagnostic pathway. Finding these indicators could significantly improve patients' overall survival and quality of life by enabling their earlier diagnosis of kidney cancer and reoccurrence. This is the conclusion. Thank you.